Hi, I'm Dr. Leslie Ellis, and I'm here to talk to you about nightmares. I'm going to spend about 10 minutes just kind of going over some of the most common questions I hear about nightmares and answer some of the questions and concerns that I hear most frequently. The first question is, what is a nightmare and what is it not? And for research purposes, people have defined nightmares as dysphoric dreams that are very memorable and wake the dreamer up. So these are differentiated from bad dreams, which can also be distressing, harrowing, frightening, or very sad, or in some way emotionally dysphoric dreams that don't wake you up. And I mean, it's a fine distinction. So I think, really for research purposes, they need to define it. But I really feel like any really scary dream could be considered a nightmare. And within that category, there are a couple of different kinds of nightmares. One is the classic dream that's associated with post-traumatic stress injury, which is a trauma nightmare. And what distinguishes these dreams is that they almost, really realistically depict a trauma, and they tend to repeat. People who suffer from these nightmares can do so for decades. And so the dreams themselves become a problem. They disrupt sleep and they don't seem to resolve. And so these are the kind of dreams that really don't seem to go away by themselves, or at least take so long to do so that it's worth looking into treatment. And if they're very frequent dreams, then they're also linked to a much higher risk of suicide. One study found up to 4 times more risk of suicide with frequent nightmares. Not so much the intensity or the distress they cause, but the level of frequency is a warning sign that says maybe you should really see somebody and get some help with them. So if you're a mental health professional, you may be asked to help with somebody's dream like this. And do you know how to help them? I would say that, first of all, most people that have nightmares are not aware that there is treatment for nightmares. And those that do might go to a professional and find that they don't know there are treatments for nightmares or how to employ them. So I have developed a course in how to treat nightmares, and I'll give you just a brief sense of what's involved. For these distressing nightmares, one of the most popular types of therapy that has amassed quite a strong evidence base is called Imagery rehearsal therapy. And there are many versions of this, and I use a little bit of a different version of this in my practice, because IRT is really based on a cognitive behavioral kind of structure, and it's simply asking the person who has the nightmares to take a dream, and even not necessarily their nightmare to start with, but just any distressing dream, and write down a new ending to this dream, and then rehearse the ending several times during the day and before sleep. And this simple practice has the effect of sometimes stopping the nightmare, in most cases changing it or reducing the frequency and the distress it causes. And it can be repeated, and it can also be something that people who learn it can use as a self-help tool. And I found in my doctoral research, I did a version of this kind of rescripting of nightmares, although the version I use is a little bit more experiential, where I ask the dreamer to go into the dream itself and allow it to complete, and to somewhere that's a little bit more of a resolved place. And I did this work with refugees, and found that for most of them, their nightmare problems really were dramatically reduced, and in some cases even stopped. And their PTSD symptoms went down by about 50% on average. So it's a very simple practice to just dream the dream onward and to a better place, and to really imagine deeply into that new ending. So you can do this with your psychotherapy clients, and if they have new dreams, you can then use the new dreams and keep working through resolving them to the point where the dreams themselves become less disturbing. And the other thing that you can do, I noticed that my research subjects and my clients then would start spontaneously doing this on their own when they woke up from a nightmare in the middle of the night and were distressed by it. They could feel like they had some control because they would go back into the dream and dream it forward. And rather than being afraid to go back to sleep, they could feel like a little bit more empowered. And they've done a number of many studies now on these nightmare treatments and various versions of them, different degrees of exposure, different degrees of experiential involvement, and they all seem to work, which is really, really quite promising. So there are many versions that can be effective, and the common denominator or the mechanism of action has been possibly identified as a person developing a sense of mastery over the dream material. So if in your sessions you can instill some confidence and a sense of mastery, then that's likely to be one of the most helpful things you can do. And you can, of course, do this with other kinds of nightmares as well. There is also what are called idiopathic nightmares. So ones that are not directly linked to a trauma, but they can be equally distressing. And idiopathic simply means we don't know where they come from. But there has been some theorizing about that it's a certain personality type that has these kinds of dreams, or that these disturbed dreams are associated with other kinds of mental illness, such as anxiety, or just a highly sensitive kind of personality, or with depression. And there's also some indication that maybe these are a result of early childhood adversity that happened before we laid down concrete memories. And so they are in a way trauma dreams, but that the trauma is implicit. And so I kind of tend to think that might be true, that people who have frequent nightmares tend to have something disturbing in their background that their dreams are trying to sort out. The other thing I'll say is just a little bit about sleep paralysis, which is something I get asked about a lot, and something that people confuse with nightmares, although it is not a nightmare. It is called as a parasomnia, so a sleep disorder of sorts, although one that isn't really dangerous. That's the first thing I want to say, is even though it's extremely terrifying for people who experience sleep disorder or sleep paralysis, it isn't actually dangerous. It's in fact something that happens to everybody every night. We all, when we go into REM sleep, will have muscle atonia. Our muscles that move our skeletal structure will be paralyzed. And this is, in fact, our body's way to protect us from thrashing around and acting out our nightmares, or getting up and jumping out the window, or hurting somebody or ourselves. So without this protective paralysis, we would have what's called REM behavior disorder, where we do enact our nightmares. And this is far more dangerous. So that we are paralyzed is a normal good thing. But most of the time, we just don't realize that we are paralyzed because we're in the middle of dreaming and sleeping. And so when we're falling asleep, or in the crossover between sleeping and waking, we actually wake up before our REM sleep is completely stopped, or we're still in this kind of in-between state. And the paralysis itself has not shut off, then we experiencing being kind of like a prisoner in our own body, kind of trapped, not able to move. You can still breathe, you can clearly move your eyes, but people experience this as a terrifying thing. There can be a sense of an evil presence in the room, sometimes a great weight on the chest. The people from Newfoundland have stories about the old sea hag, or the sea witch, that comes in the night and comes through the window and sits on your chest. And this is a story that's been made up to really account for sleep paralysis. And it's something that's been documented over centuries. I would say about 8% of people might experience this in their lifetime. But people who have psychiatric diagnoses like depression, or sleep disorders, or anxiety, panic disorder, tend to have more sleep paralysis. So about 30% of those people, shift workers and students, anybody with really disrupted sleep can experience this more often. As well, it's associated with substance use, alcohol, and with sleeping on your back. So those are the kinds of things that would tell you a little bit about what you could do about sleep paralysis as well, which is, really limiting substances, trying to limit stress, trying not to sleep on your back, and also just recognizing when you're in it that it's a normal state and it will pass. And I have a lot more to say about how to work with dreams and nightmares, sleep paralysis, and all kinds of other information about the fascinating world of dreaming. So if you'd like to hear more about it, I will have lots of resources for you. Thank you.